Good morning, students. Today I'm here for the second chapter of hospital pharmacy, that is Introduction to Hospital Pharmacy. So first of all, we discuss about the definition of hospital pharmacy. So what is hospital pharmacy? Actually, it is a department or a service in a hospital which is responsible for the supply of medications to the hospital wards as well as ambulatory patients. Okay, so the department is basically headed by the professionally competent, legally qualified pharmacist who directly supervises and ensures the correct dispensing, compounding, and distribution of medication to both inpatients and the outpatients. We have already discussed what are the inpatients that stay in the hospital and outpatients that just come there to for the diagnosis and for the prescription. So basically, hospital is the department which deals with the dispensing, compounding, and distribution of medication, along with the procurement, storage, compounding, manufacturing, testing, packaging, and distribution of the drugs. Okay, it is also concerned with the education and the research in the pharmaceutical services. Next are the functions of the hospital pharmacy. So basically, pharmacy is recognized as an essential hospital service in all the major hospitals. It is managed by the professionally qualified pharmacist, as I have already told. Pharmacists is basically have to perform the various functions in the hospital pharmacy. He acts as a link between the physician and the patient. So the first function is filling and the labeling of all the drug containers from which medicines are to be administered. Okay, so that is the prime function of the pharmacist, to fill and label all the drug containers. So when they are required, that can be easily supplied to the respective department of the hospital. Second function is management of the stores, which includes purchase of drugs, proper storage conditions, and the maintenance of records. Management of the store is a very important and essential function of a pharmacist, because they have to maintain all the records regarding the purchase of the drugs. They have to purchase the drug by first applying for the quotation, and according to the quotation they just purchase. Their prime requirement is to purchase that type of drug which have good quality and the low price. Then they have to store, the proper storage conditions should be there, and finally maintenance of records are there. Okay, third function is establishment and maintenance of the drug information center, which will provide the information regarding the medications to the physicians, nurses, or any other competent person who deals in the drugs. Next function is providing the cooperation in teaching and the research programs. Again, it's an important function because they have become a link between the teaching and research programs of the hospital. Next function is manufacturing and distribution of the medicaments such as transfusion fluids, parenteral products, tablets, capsules, ointments, and stock mixtures. That manufacturing department is just the adjacent of the medical stores, and they just have to manufacture such type of fluids which which required in the hospital. Next is the dispensing and sterilizing the parenteral preparations which are manufactured in the hospital. So all the parenteral preparations which are manufactured in the hospital, they need to be sterilized before dispensing or before distribution to the respective department of the hospital. Next function is dispensing of the drugs as per the prescriptions of the medical staff of the hospital. It's a very important function, because according to the prescription, the pharmacist dispense the drug to the inpatients and the outpatients of the hospital. Next function is to discard the expired drugs and containers, worn and missing labels. Okay, so any expired drug should be discarded. So by mistake they didn't give to the patient, and missing label container should be discarded. Okay, then that is very important. Next function is patient counseling services. So patient counseling services is needed while supplying drugs, especially from the outpatient department, to just counsel them about the about the timing of the medicines, about the quantity of medication should be taken, and about the drug interactions, about drug food interactions. So patient counseling services are also provided by the hospital pharmacy. So these are the functions. Next topic is the objectives of the hospital pharmacy. So the practice of hospital pharmacy started in India in 1941, but became a respectable discipline only in 16th. So the objectives of hospital pharmacy are to ensure the availability of right medication at a right time, in the right dose, at the minimum possible cost. Okay, so right medication is always needed, but it should be at the right time and it should be in the right dose. Okay, and to reduce the economic cost of the hospital, it has a minimum possible cost. Next objective is to professionalize the functioning of pharmaceutical services in a hospital. Third is to act as a counseling department for medical staff, nurses, and for patients. So I've already discussed this in function. So it is an important goal of the hospital pharmacy to act as a counseling department, to instruct the medical staff, not instruct, but to counsel them, and to become a link between the medical staff and the nurses and the patients. Next goal is to act as a data bank on the drug utilization. Next is to participate in the research projects. The research projects, because hospital pharmacy is also related, become a coordination between the teaching and the research work. So it also participate in research projects. Next objective is to plan, organize, and implement the pharmacy policy procedures. So it can keep the established policies of the hospitals. Next is to coordinate and cooperate with the other departments of a hospital. So whenever any requirement is come from any respective department, they can easily send the drug or the necessary material to the respective department. So there should be proper coordination, then it is possible. Next topic is the location of the hospital pharmacy. The pharmacy should be located in the hospital premises so that patient and staff can easily approach it. Okay, it should be in the ground floor. In the multi-story building of a hospital, the pharmacy should be preferably located on the ground floor, especially the dispensing unit, where we have to dispense the medicine according to the prescription by the doctor. Third is the departments are so laid out that there's a continuous flow of men and materials. Outpatient pharmacy should give a pleasant appearance and must have enough space for sitting of patients who have to wait for the medicines. So they can easily wait, they don't rush. Okay. Then the OPDs, again the outpatient pharmacy department's waiting room should give a professional look. It should have educative posters on the health and hygiene and light literature for the reading. So they can easily pass their time there if there's a rush. Space must be provided for routine manufacturing of stock solution, bulk powders, ointments, etc. We have already discussed this in parenteral. So space should be there for the manufacturing room, and the manufacturing room should be adjacent to the pharmacy. So this is the location of a good hospital pharmacy. This is the planning and layout of the hospital pharmacy. Aseptic section is there, where we can easily, for the parenterals, we can easily sterilize condition can be provided for the manufacturing section. And to the adjacent to the manufacturing section, there is a raw material store and stores and the finished product room. In between, there is a passage, and to the adjacent to this, there is an administrative section and the dispensing section for the for dispensing the medicines to the inpatients and the outpatients. Next is the flow charts for materials and the men. So this is the general flow chart for outpatients. Okay, first of all, the prescription is written by the doctor. Then that prescription is received by the pharmacist. Okay, that pharmacist fill the prescription. That means they can easily select labeling and pricing will be done. Then it is dispensed to the patient. Okay, dispensed to the patient. After that, receipt of payment is there. It may be free in government hospitals or cash or charges, whatever it is. And then the prescription filled, regular prescription file, a narcotic prescription file should be recorded in the hospital pharmacy department, because medical record should be there. Recording of the drugs should be there, so that it can be easily accessible whenever required, so that it can be easily accessible from whenever required for the further requirement. Like if you want to know that if our material, our drug is finished, so that can be easily accessible when we have a record register or computer. Okay, this is a flow chart for the inpatients. So it is almost similar, but the difference is the prescription written by the doctor, but they can be taken by the inpatient discharge medications. Again, prescription received by the pharmacist, they further fill the prescription, dispense the prescription, or the prescription written by the doctor goes to the nurse, and then the inpatient, then they give it to the inpatient, and they further take it from the pharmacist. Or the prescription written by the doctor directly goes to the pharmacy, or they can be coordinate with both of them. So further the procedure is same, but in case of inpatients, it may be goes from the nurse side, or it can be directly given to the inpatient. Next topic is the flow chart for the materials. So how the material is distributed. So first of all, the medical store is there. Okay, medical store uh, manufacturing the parenterals. Okay, then the they receipt it to the pharmacy. Actually, medical store of a pharmacy should be adjacent to the pharmacy itself, or should be directly connected with the pharmacy. So pharmacy receive the material, that the flow chart of material shows that the pharmacy receives the material from the two sources. One is the medical store directly, or the manufacturing division of the hospital. Okay, it may be parenteral manufacturing division or manufacturing of the other dosage forms. So medical stores and the manufacturing unit issues against the requirement from the various department. Pharmacy department exercises the quality control of the material, because quality control is essential. Okay, after the quality control of material, pharmacy issues the material to the inpatients or the outpatients. So inpatients are served by the nursing stations also, who receive their material from the pharmacy. As I have already discussed in the flow chart for inpatient, that the prescription is also given from through the nurses also. So again, here also the inpatients are served by the nursing stations also, who receive their materials from the pharmacy. So this is basically the flow chart for the material. So we have discussed here the flow chart for the inpatients, flow chart for the outpatients, and the flow chart for the materials. Okay, next topics are covered in part 2 of this lecture. Okay, thank you so much.